We're learning more about President Joe Biden's recovery from COVID-19. In a new statement, the White House says Biden's symptoms have improved after one day of taking Paxlovid. The statement adds that the president continues to experience mild symptoms, cough, fatigue, runny nose, and that's what they're telling us. So for more, let's bring in ABC News senior national policy reporter Flaherty and medical contributor and physician at Stanford Children's, Dr. Alok Patel. Dr. Patel, let me begin with you. We know President Biden has mild symptoms, as the White House is telling us. You know, what would you be looking for? What do you look for in patients at that age, at this stage, given what we're seeing?
Well, Terry, generally speaking, we are looking for exactly what Dr. O'Connor covered in that first paragraph. So there are statements about the present symptoms that President Biden has. He reports a runny nose, feeling a little bit of fatigue, but no real shortness of breath. That was not reported at all. So this is actually a good indicator of how he is presently doing in progression from yesterday. Also, those vital signs are critically important. Things like your heart rate, your respiratory rate, and your oxygen saturation, meaning how much oxygen is actually in your blood. Those are extremely important because it actually tells us how your body is responding to an active infection. So this is optimistic news that all of these right now, according to this letter, are normal in President Biden.
And he's well enough to work. He continues to work. And despite being sick with COVID-19, he's held multiple virtual meetings today. How does that work in a White House where the president has COVID? What kind of protocols have they got?
Well, first of all, it works much as it does for the rest of us, which is that he's doing everything virtually. He's doing everything online. We do know that yesterday the White House reduced their residential staff to essential staff only. We don't know if they're still in that mode. We can't expect that there's a very limited number of people around the president. So, you know, I think that in the coming days, they're going to be testing people. You have to wait 3 to 5 days after your exposure from someone with COVID before you can test to accurately determine whether or not you have COVID. And then I think, you know, that's assuming if people have been vaccinated, they should be wearing a mask. Otherwise, they need to be staying home because they could potentially spread it. So the White House says they're being very careful on this. They're following all the CDC guidance and rules on this. And it's TBD to see how much that it might have spread to those known contacts.
And during the briefing yesterday, reporters, you know, again and again and again raised concerns on whether the White House has been following COVID protocols after the president was seen in photos and video of him maskless. Despite testing positive for COVID, somebody took his picture there. So there's a lot of concern about, I don't want to say the COVID police, but the people who are, you know, really watching every jot and tittle of what the president's doing. There he is once again on the balcony there without a mask, and that was asked about. What do you make of this course correction that they've made where they remind the public that the president is fully vaccinated and double boosted and all the rest of it?
Well, you know, they certainly are trying to set the example, and they had a misstep there. You know, the White House told us when they did the video, they were outside. So presumably the person that was filming him would have been 6 feet away. They're in the outdoor space. The president wouldn't necessarily need to wear a mask in that case under CDC guidance. But certainly that first photograph that you just put up there, he wasn't wearing a mask and he was indoors. So I think that was a misstep by the White House. A lot of us have kind of forgotten what all of the rules are with COVID. We've gotten so used to living with it. And then the rules kept changing. So, you know, I think going forward, you're going to see more masks. You might see fewer handshakes. That's going to be the protocols going forward. He's got several more days of this isolation, assuming he doesn't have symptoms coming out of those 5 days. Then he can, you know, attend meetings in person again, but he's going to have to wear a mask.
And we'll see how that goes. Dr. Patel, I want to ask you about this moment, right? So we still have many Americans hesitant to take up the vaccine. Here's the president at 79 years old at this point, after being double vaccinated, double boosted, looking, you know, pretty good in the early days of this infection. I wonder if you think this is a teaching moment for people. These shots, for all of us who've had them and had COVID, the relief that you have if you get a positive COVID test result after being vaccinated, I can't imagine what it would be if you aren't vaccinated. Do you think this can boost that lower number of vaccinated Americans?
Undoubtedly, Terry. I think this is a very good example of a teaching moment. And we saw this yesterday with Dr. Jha in the White House briefing room, almost using this as a public service announcement to tell people, hey, if you want to hedge your bets against severe illness, you know what to do. You want to go and get vaccines. I think now it's time, as we approach fall and a lot of unknowns, that we kind of reiterate the message that the vaccines may not necessarily prevent a positive test, That's not what they were designed to do. They're going to prevent progression to severe illness. And there are a lot of hesitant people out there. We're seeing this on social media saying, hey, we thought the vaccines prevented testing positive. This means they don't work. And we know that's not true. A positive SARS-CoV-2 test does not mean it's going to progress into severe COVID-19 illness. And you're going to reduce those chances dramatically if you are fully vaccinated.
And that's what we hope will happen. The president's doing well. All of us who've had it and been vaccinated can testify to the efficacy of these vaccines. Dr. Alok Patel and Flaherty, thanks very much, as always.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.